Colic is when a healthy baby cries for a very long time, for no obvious reason. It affects some babies during the first 3 to 4 months of life. Colic usually begins suddenly, with loud and mostly non-stop crying. Colicky babies can be very difficult to calm down. Colic is defined as when a baby's crying lasts for more than 3 hours a day, happens more than 3 days a week, occurs for more than 3 weeks. Colic often begins suddenly, with loud and mostly non-stop crying. This constant, extreme crying can be very stressful and difficult for parents, babies with C. Babies with colic are often fussy, gassy, and don't sleep well, but in most cases they grow and gain weight normally. Colic will go away on its own. This often happens by age 3 months, and in most cases by age 6 months. What causes colic? Experts don't know for sure what causes colic. There are a few theories about why it happens. Colic may occur when babies are sensitive and have trouble adjusting to the world. After birth, newborns must get used to lights, loud noises, and other new things around them. Being sensitive to gas. Some people think that gas may be to blame for colic, but there isn't much proof to support this. In fact, treating gas has no effect on colic. Health experts also don't think that colicky babies make more gas than other infants. Sometimes a colicky baby may seem to pass more. Sometimes a colicky baby may seem to pass more gas than other babies do, but that is likely because he or she swallows more air while crying for longer periods of time. Having a milk allergy or intolerance. Having a milk allergy or an intolerance to cow's milk protein may cause belly pain, but often these also cause loose stool diarrhea. A baby may have a milk allergy if he or she can't handle cow's milk and reacts to a change in formula. But there is no proof that changing to a non-milk formula has any effect on colic. What are the symptoms of colic? A healthy baby may have colic if he or she cries or is fussy for several hours a day, for no obvious reason. Colicky babies often cry from PM to midnight. Colicky crying is louder, more high-pitched, and more urgent sounding than regular crying. Colicky babies can be very hard to calm down. Burping often or passing a lot of gas. This is likely because of swallowing air while crying. It doesn't cause colic. Having a bright red flushed face. Having a tight belly. Curling up their legs toward their belly when crying. Clenching their fists when crying. How is colic treated? There are many tips for helping to soothe and deal with a colicky baby. Know that this is a common problem for new babies. Talk with your child's healthcare provider to find out more about colic and what you can do. If your baby is bottle fed, it may help to use a curved bottle. This lets you hold your baby in an upright position. To reduce the amount of air your baby swallows during feeding, burp your baby often. Using a bottle with a collapsible bag or liner may also help. Talk to your baby. Sing softly to your baby, rock your baby, walk your baby, give your baby a warm bath, place your baby in an infant swing on a slow setting, let your baby lie on his or her belly on your lap, and softly rub your baby's back.